Hello, my name's Lisa. I'm one of a small group of midwives who will be accompanying some of you into theatre when you have your planned caesarean birth of your baby. And this is your pre-op class. Welcome. This is a slightly updated version of the pre-op film that we recently produced, obviously in light of the current situation, so certain things have changed. What should have happened for each of you so far is that this caesarean birth has been planned with yourself and your consultant or a doctor working under them, and you have been given a date to obviously come in and have your baby. You will have hopefully been sent a letter through the post explaining the basics of having your caesarean birth, and we'll also be sending you lots of information leaflets. One of the really important things that will arrive is a blood test form, and this is specific for each of you because you need to have a blood test done on a specific day before you come in to have your baby to ensure we know what your current iron level is and to double check your blood group and make sure you haven't developed any antibodies within your pregnancy. This blood test form you will notice is orange, and you can have your blood test done at either West Berks Hospital in Newbury, at the Royal Berks Hospital or Brantesbridge in Bracknell at their pathology labs. You need to just take the form along, they will do the blood test, and then you can go and you don't need to wait for the results. It's not a fasting blood test, so you can go any time during the day, but West Berks do ask that you make an appointment to go to their pathology lab to have theirs done. Brantesbridge and the Royal Berks is just a drop-in. You will also notice we have sent you a prescription, and this prescription needs to be picked up from one of your local pharmacies, and the prescription that you're going to receive has some medication on it to take the night before and the morning of the operation, and everything else on the prescription is to be kept at home. This is your pain relief, things to help with your bowels, and for some of you you'll need some blood thinning injections, and this is all for postnatally when you come home with your baby. So please make sure you pick up your prescription in advance of coming in to have baby, because there are some medications you need, as I said, take the night before and the morning of the operation. I'll go through what's on those in more detail in a moment. You will also be sent a parking permit to come into the car park, obviously on the day. If the barriers are working, they're not always, obviously. Take a ticket from the barrier, and then whoever is driving, when it comes for them to leave, they just show that permit to the security desk near the Marks and Spencers, and you'll be able to park for free. It is valid up until the next day, but we can't extend it any further than that, but you can come and go within that time. You will also have received lots of information leaflets, one about vitamin K. This is just to remind you that we do recommend all babies are given a dose of vitamin K after birth, and the leaflet reminds you of why and how that's given. There's also a leaflet for your birth partner. Now, in current times, it is just your birth partner that can accompany you into hospital to have baby, and the leaflet is for them to have a little read of what's expected of them in theatre, what to expect on the day, what their role is, so make sure they have a read of that before you come in. We have also included some information about personalising your caesarean birth. This is quite a different situation to having an emergency caesarean. It's not going to be in a rush or an emergency situation, so we are expecting baby to be born in good condition. So we will be strongly recommending delayed cord clamping, immediate skin to skin of baby once baby is born. We have the option, if you would like to see the birth of your baby, not the operation itself, but the birth of your baby. We have a special mirror that we can offer you and your birth partner, to actually watch baby being born. And we're quite happy for you to play your own music if you would like to in theatre. These are just some of the things that we suggest, but if there's anything else you would like to do to personalise your own birth experience while having your baby in theatre, please just have a chat with your midwife on the day or the consultant when you meet with them. You will also receive a leaflet about breastfeeding and the painkiller that we prescribe you. So we do prescribe quite a strong painkiller for you for after you've had your baby, and we strongly recommend you take both paracetamol and ibuprofen if you're not allergic to them, along with this painkiller that we prescribe you. The paracetamol and ibuprofen are obviously very cheap to buy, so the NHS no longer prescribe those, so get a stock of those in at home and take them alongside the strong painkiller that we give you. The leaflet explains about breastfeeding and this strong painkiller, because as with anything that you take in, a small portion of that will go through the breast milk and can affect your baby, but it's very unusual for it to affect baby. The leaflet gives you the information about what to look out for. Basically, if the painkiller affects you quite strongly and makes you feel very drowsy, there is a chance that could happen to your baby as well. So make sure you have a read of the leaflet to understand what you're looking out for, and let us know if you have any concerns. So your prescription, as I mentioned, needs to be picked up from one of your local pharmacies. And the first medication on there is some antacid medication. With planned caesarean birth, we need you to stop eating from midnight the night before you come in to have baby, and have an empty stomach, obviously, for the operation itself. But when your tummy's empty and you stop eating, you continue to make stomach acid, so we do need to neutralise this for the duration of the operation. So the first medication is antacid medication, and it will give you the instructions on the box of when to take, but it's actually at 10 p.m. the night before and 6 a.m. on the morning of the operation itself. The next thing is the painkiller, as I mentioned. This is currently called dihydrocodone, which is the safest painkiller that we've found to use when breastfeeding. You'll get a week's supply of this. Most women after having a caesarean do probably need painkillers for up to a week after the birth of baby. What we suggest is you take all 3 of the medications mentioned and then gradually wean yourself down from the stronger one and continue on with the paracetamol and the ibuprofen for a little while longer. We wouldn't expect you to need this strong painkiller for more than a week, and if you are having concerns about pain, obviously after a week, then please get in touch with us and let us know so we can reevaluate. And for some of you, but not all of you, you will be prescribed a clot prevention medication, which are some little injections that you need to give yourself for either 10 days or 6 weeks after you've had the operation. Please don't worry if it's not on your prescription. It may be that at this time you've been identified as being lower risk for blood clots after delivery. And for those of you that may have had a caesarean before, an emergency caesarean, and you might have had these injections, it doesn't automatically mean you'll need them again for a planned caesarean birth. It's slightly different. If you've never had these injections before, bring 1 or 2 doses of that medication in with you when you come in to have baby, and we'll show you how to self-administer it on the first night after you've had baby. But if you know how to do them, then just leave them at home ready for when you go home. So this prescription will obviously need picking up from a pharmacy in advance of coming in to have baby because of the medication I mentioned from the night before. Hopefully most of you have had a chance to have a little look at our older version of the pre-op video, which is on YouTube. If you Google Royal Barks and enhanced recovery, you'll find it. And that video, it talks a lot about enhanced recovery. So evidence has shown that people do recover much better at home after quite a lot of operations rather than spending a long period of time in hospital. And there's lots of reasons for this. The most obvious ones are people sleep better at home, particularly on maternity wards, obviously. Even if your baby's asleep, somebody else's may be awake, so you don't get very good sleep. Nutrition, if you are at home, you are able to eat as and when you want. We obviously do feed you in hospital, but it's not quite the same as eating at home. And the longer you spend in hospital, you're more likely to pick up hospital-acquired infections. And we've known this for many years. This has been on the general side. We introduced it to having a planned caesarean birth in the last few years, and the feedback from everybody has been really positive. Women are keen to get home as quickly as possible after their operation to obviously look after their new baby and probably other children at home as well. We just know that people do recover quicker from surgery in the home environment rather than in hospital. So the principles of enhanced recovery are thinking about having your baby as a bit like a sporting event, imagining you are an athlete and having your baby as the marathon that you're going to run. So the same as an athlete would do, you would not do a hard day's training a day before a marathon, so that we're asking that you try and have as well restful a day as possible the day before you come in to have baby. So please don't be rushing around doing all your shopping. Try and rest and give your body plenty of opportunities to rest throughout the day. We also want you to be really well nourished. So like an athlete would do, you would eat really well the day before a big sporting event. So 3 proper meals, and in particular, do a bit of carb loading like an athlete would do. So a high carbohydrate evening meal, something like pasta or rice, and even a snack before you go to bed will really give your body the energy store that you'll need to get you through the period the following day where you won't be able to eat for a while. We also want you to be really well hydrated and to drink really well the day before your operation. Continue drinking all day, and then from midnight what we need you to do is actually stop eating and have no more food after midnight, but we do want you to continue drinking until you come in the morning at 7:30 on the day you're due to have your baby. The only 2 drinks though from midnight that the anaesthetists are happy for you to drink are going to be water or the non-fizzy Lucozade Sport. So it's an isotonic drink, a bit like an athlete would have, and they're nice and light on the stomach, and it's a clear fluid, so nothing else, no tea or coffee, no fruit juices, just water or the Lucozade Sport, and it must be the non-fizzy variety. These are the things that you can really do to help your body to go through that period of starvation and from the operation side of things the next day, and it will just speed up your recovery. The things that we have changed in the hospital in the last few years is the catheter that goes into your bladder, obviously because when you have the spinal you won't be able to feel the need to pass urine initially, but we give you an opportunity of about 12 hours, so after 12 hours after baby's born we'll take that catheter out, and by that time you'll be up and mobile, the spinal will have worn off, and you'll hopefully be able to go to the toilet and pass urine, and we'll find out for definite everything's okay in that area. We are aiming with enhanced recovery to hopefully discharge you by about lunchtime, early afternoon of the following day. Not everybody will be suitable for obviously enhanced recovery. If you have a pre-existing condition such as high blood pressure or diabetes, it may be that you do need to spend longer in hospital with us, but by following the sort of guidance of enhanced recovery, you're going to feel so much better in yourself and recover from the operation itself much quicker and be able to look after your baby. So a run through of what happens on the day itself. There is a copy of this that we'll have sent you in your pack as well. 10 p.m. the night before you come in to have baby, you need to take your antacid medication, and this doesn't matter when you've last eaten, when you've had your meal or your snack, it must be at 10 p.m. No food after midnight, and that applies to everybody. Nothing must pass your lips other than fluid after midnight. Between midnight and when you come in the morning at 7:30, you can sip water or the Lucozade Sport, as mentioned, as freely as you like, but as soon as you come into hospital, please stop drinking until we tell you otherwise. We need you to get up at 6 a.m. on the morning you're coming to have baby and take your second lot of antacid medication. If you take any other regular medication, please only take it on the day if it's really essential. So things such as iron tablets, pregnancy vitamins and minerals, please don't take those. If it's for blood pressure or epilepsy, that's obviously essential, please take them. If you're not sure about any medication that you currently take, about whether to take it or not, please ring the number that you'll see on the bottom of the screen and we'll discuss with you whether we think you should take it. When you get up at 6, what we ask that you do is then have a bath or shower whilst you're still at home. So have a really good wash. Any sort of soap or shower gel is absolutely fine, whatever you normally use. What we'd like you to do is to pay particular attention to your tummy and down below to get rid of as much skin bacteria as possible and causing an infection. What we don't want you to do though is put any body lotions, oils or creams on afterwards. So please just pat dry and don't put on any makeup. Please don't wear any jewellery or any nail varnish. We're not too worried about toes, but fingers in particular. Our equipment doesn't work if you have nail varnish, particularly the acrylics and the gel, so please make sure that's removed before the day. Jewellery is obviously because we need to know about any metal. If there is any jewellery that can't be removed, so if you have any piercings that you can't undo or any rings that currently won't come off because if your fingers are quite swollen, just let the midwife know when you arrive and we'll make sure we're aware of it and tape it up for you. So on that morning we need you to arrive at 7:30 to the day assessment unit, which is level 3 of the maternity block. Obviously it is just one birth partner to bring with you, the person that's coming into theatre with you. What we ask is that you bring in a bottle of Lucozade if you would like to drink the Lucozade, because the way the planned caesarean lists work is that we have a maximum of 3 cases a day, but until everybody arrives, we can't decide on the order of who goes first, second or third. So it's the consultant's decision and it's based on the circumstances of each day, obviously. So if you are told you're going to be second or third on the list when you arrive, what we'll encourage you to do is to continue drinking for another period of time so that you don't get dehydrated. So that's where the bottle of Lucozade may come into effect. Everybody arrives at 7:30, having stopped drinking at the same time, so that once we decide who's first, the first person can be in theatre having their baby by about 8:30. We want you to bring with you, when you come to the day assessment, obviously your birth partner, this bottle of Lucozade if you would like to. We also suggest some chewing gum. For any of you that have ever had any abdominal surgery before, when the bowel is exposed, it can make it quite sluggish and it can cause quite bad trapped wind and lots of abdominal discomfort. Chewing gum has been found to be quite effective, that if you chew a piece of chewing gum before you start eating solid food again, it will help sort of speed up that process of the gases and the gastric juices and things in your bowel, so that will kind of help that constipation and bloated feeling. So as I said, we want you to arrive at the day assessment unit for 7:30. So on that morning you will meet with the consultant and the anaesthetist. The consultant will have a chat with you about your individual circumstances and what's likely to happen. Please obviously tell them about any concerns you have or any worries or any specific requests that you also have. The anaesthetist will have a chat to you about what type of anaesthetic is going to be used to make sure you obviously don't feel the pain of the operation. You will have been sent a leaflet explaining about the different types of anaesthesia, and it's important that you've read this so that you understand the differences between a spinal, an epidural and a general anaesthetic. The midwife will meet you, that's also going to accompany you into theatre that day, and herself and a care assistant will be preparing both you and your birth partner in the appropriate clothing to go into theatre. So once it's time for you to go to theatre, as I say, we normally aim to be in theatre with the first case by about 8:30, and as a very rough guide, each operation can take about an hour and a half to 2 hours. But we will head to theatre, and we actually walk and we take all of your bits and pieces with us. We go into theatre to have your baby or babies, and then once you've had your baby or babies, we transfer you to a room outside of theatre, which is the recovery area, where you are for a couple of hours, and this is where we will get baby feeding, and we will also give you a light snack of something to eat and drink to make sure that obviously you're recovering well. In terms of feeding, we are there to support you however you choose to feed. If you are planning on breastfeeding, have a read of the leaflet we will have sent you about antenatal hand expressing. So we strongly encourage you, if you are planning on having a caesarean birth, and particularly if you're diabetic or having twins or triplets, to have a little practice at hand expressing before your babies arrive. It's a really useful skill to support breastfeeding so that you know, one, how to hand express, and two, to allow you to hopefully see some colostrum being produced. You can refer to the Royal Berkshire Hospital website. There's an infant feeding section on there that will give you some videos and top tips about how to hand express. So once you're in recovery, we will assist you if you hope to breastfeed and help you with breastfeeding. If you are planning on artificially feeding your baby, you do need to bring your own formula into hospital with you. All of the different makes do little starter packs with little ready-made up bottles and disposable teats. Or alternatively, if you buy the ready-made up formula in cartons and bring in some of your own bottles, that's a slightly cheaper version of doing that. We just don't unfortunately have the facilities for making up lots of formula feeds up on the wards, and we no longer provide formula for you, so you do have to bring it in with you. Once we're happy that you and baby have fed and we're happy with your recovery, we transfer you up to one of the postnatal wards. Your birth partner can obviously stay with you throughout the day until 9 p.m. that night, when they will obviously be asked to go home and the ward is closed to visitors. And then they can return to the ward at 8 o'clock the next morning to come and see you and baby. In the current times, obviously, I'm afraid there are no other visitors on the ward, and we are aiming though for most of you to be discharged the following day. If you have any questions about anything mentioned in this video, or any concerns obviously about any symptoms that yourself, your family or your birth partner are displaying, please ring the number that we're going to give you at the bottom of the screen to discuss with us before coming in to have your baby. But otherwise, we look forward to seeing you on the day. Thank you.